Hi, I'm Jade McNamara. I'm a paediatric respiratory nurse at Queensland Children's Lung and Sleep Specialist. The aim of this video is to help with your education, getting you ready to take your baby home on oxygen. You would have received a written pack as well, and everything that I'm going to go through at the moment is all in your written pack, so you can use that as a reference. Now, in your pack, you would have received a welcome letter, as well as the written information of everything that we're going to go through. You also would have received a going home checklist. These are all of the things that I need you to be comfortable with before you go home. So just have a read through and keep those things in mind as we're going through everything. The things we'll cover today include the goal of oxygen therapy for your baby, the paperwork required, the oxygen tanks, the care of your baby on oxygen, some safety checks, how to recognise if your baby is becoming unwell, what to do in an emergency, changing the tapes and prongs, who to call and when to call, and follow-up and weaning. It can be a little bit overwhelming hearing that your baby will go home on oxygen, but always remember we are here to support you and make sure you are ready to go home. This doesn't end once you're discharged. We are just a phone call away if you have any questions. So let's get started. By now, your doctor or one of our respiratory doctors should have had a discussion with you around why your baby is going home with oxygen. If you still have any questions about this, please let me know. Basically, the aim of the oxygen is to help your baby grow and thrive. A couple of things before you go home, you'll be given some paperwork that you need to fill out, and our respiratory doctors will fill this out as well. Some of that paperwork goes to the government agency called the Medical Aid Subsidy Scheme, and these are the people that will organise your oxygen to be delivered. The other bit of the paperwork goes to Centrelink, and this is so that you can get a healthcare card. Pretty much all babies on oxygen are eligible for a healthcare card. However, this is means tested. So if you have any questions about that, ask myself, the discharge coordinator, or any of the nurses on the floor. Once we receive your paperwork back, we'll send that through to MAS. They contact the local oxygen delivery team, who will then be in touch with you to organise a delivery time. Generally, it's the next day or two. Someone will need to be home to accept delivery of the oxygen because they'll go through some important things with you, such as how to turn the oxygen on, how to change the regulator, how to know when it's time to order some new oxygen. If you can't be home, you need to organise someone that's trusted to be home to take delivery of the oxygen. And one thing I do suggest is, even if that person wants to film what the oxygen delivery technicians are going through, it just gives you a reference to look back on. They'll also leave you with some written information as well. And as always, if you have any questions, you can ring myself here or flick me an email anytime. As I mentioned, the oxygen technician will go through everything with you regarding your tanks, but there's a couple of things I just wanted to make sure you understand. Depending on how much oxygen you're on or your baby is on will depend on how many tanks you get. But generally you'll get 2 quite big tanks and then 3 to 6 portable tanks, depending on the flow that your baby's on. They'll go through with you when they deliver your oxygen where's the best place in your house to put the tanks, depending on where your baby's going to be doing most of it sleeping and where you'll be doing most of awake playtime. You'll also get a large extension tube as well, so it just gives you a little bit more freedom with moving around the house. A couple of things with the tanks. They can't be stored near any heat or flames because it is oxygen, and don't use any oil-based cleaners on them. If you happen to spill anything on them or if they get dusty, you can just use a dishcloth with some warm water to clean it all off. And obviously, as with any baby, strictly no smoking around your baby or around the oxygen. Now, the amount of oxygen that your baby will go home on is determined by our respiratory physicians. And the oxygen delivery technician will show you how to dial this oxygen amount up on your tank. So they'll show you how to turn your oxygen on, how to change these regulators over, and on the dial, how to tell if your oxygen is running low. They'll also let you know when to call to reorder the oxygen. Regulators are basically the same. You turn it on here, check that you've got oxygen in your tank, and then you'll dial up the prescribed amount of oxygen on your dial here. Now, everyone will talk about oxygen in different ways. Here and in special care, we talk about oxygen in mils. So you might be told you're going home on 500 mils of oxygen, 250 mils of oxygen. The oxygen regulators are in fractions, and again, they'll demonstrate to you how to turn this on. But say here, this is half a litre, so I'd turn that up to half a litre. They'll show you how to change your regulator from tank to tank. Depending on how many tanks you've got, will allow the amount of regulators that you've got. Generally, you get one regulator for a big tank and one regulator for your portable tanks. It can sometimes get a bit fiddly changing the regulators over all the time, and as I said, they'll demonstrate to you how to do that. If you want to, you can hire an extra regulator if you get a bit sick of changing it over constantly. They're about $38 a month to hire. The other thing I suggest is if you're finding you're going from your big tanks a lot, so say if you've got a 2-story house and you're going from upstairs to downstairs a lot, you could put your portable oxygen regulator on your other big tank so that when you're changing over, you're not having to change the regulator all the time. You're just able then to just disconnect your oxygen and move it to the next tank and regulator. If this isn't making sense at the moment, it will once you have your oxygen delivered and they go through it with you. But again, please, if you have any questions at all, just give me a call and we can go through it as well over the phone. The oxygen delivery people will show you on your dial when to call them to order new oxygen. Just do bear in mind that they don't deliver on a weekend except in an emergency. So if, say, on a Thursday you think you're going to run low, it's always better just to ring an order and they'll deliver the next day. So now to looking after your baby on oxygen. Oxygen can sometimes be a little drying to their nose, and so it can make them sometimes a little bit sniffly. Often babies on oxygen can have a little bit of a sniff because, as I said, the oxygen dries their nose out and it can just cause a bit of extra secretions there. One way to counteract this is with normal saline. So you would have seen the nursing staff in the hospital use normal saline drops in your baby's nose. And this is just to keep their nose from drying out. When you get home, you can continue to use those saline drops, or what can be easier is if you purchase a saline spray. One that I really like is called Flow Baby, and you can purchase that from any chemist. A lot of the pediatricians will actually write up Flow Baby for you on your discharge medications as well, and it will be given to you by pharmacy before you leave the hospital. Basically, you just want to gently pull the prongs out and do one squirt up each nostril and then put the prongs back in your baby's nose. The amount of saline spray is a measured dose, so you don't have to worry about giving too much or too little. You have to do this at least 2 times a day, so morning and night. However, if you're finding that your baby has got a few secretions, you can increase this. What you want to do is make sure that those secretions are kept loose, because where babies get into trouble is when the secretions become thick and it makes it difficult for them to clear. And this happens right in the back of the nasopharyngeal passage where you can't really see it. It's important to keep that nice and loose so that they can swallow their secretions down and keep their nose really clear. If you're finding, for example, that you go to feed your baby and they pull away and fuss about a bit, it might be that their nose is a little bit blocked. So it can be really beneficial to give them a little spray up each nostril before feeding, just to make sure everything's clear. Like I said, don't be afraid to use the saline spray. The only time that I would suggest that you would give us a call about using too much saline spray is if you say, for example, have really only needed to use it 2 or 3 times a day, and then you find your baby's becoming more sniffly, so you're needing to increase it. Because your baby's becoming more sniffly, it might be an indication that they're brewing a little cold, and that's something we'd like to know about. So you can just flick me an email or give us a call in the rooms here and speak to myself or one of the doctors. So, with your baby, you know what's normal for your baby. You know how hard and fast your baby normally breathes, the colour that your baby normally is, and how active they normally are. What is important is for you to recognise if anything's changing. So say if you're looking at your baby and you think, oh, I just feel like they're breathing a little bit faster and harder than what they normally do, but you're not too worried, you can just give us a call and let us know here in the rooms. You could call your paediatrician, or if you've got a good GP, you could give your GP a call. Please don't ever hesitate to get your baby reviewed if you're worried. I tell everyone to have a very low threshold for getting your baby looked at if you're worried. If you were, however, to look at your baby and you were really concerned, you thought they were working a lot harder than they normally do to breathe, they're breathing harder, they're breathing faster, and you're worried, don't ever hesitate to get them urgently reviewed. And if you're really worried, call 000. Best case scenario is someone looks at your baby and says they're okay, but have a low threshold for calling an ambulance or taking them to hospital if you're worried, especially when you start seeing them work hard and using all those muscles that they're trying to use to get a breath in. So their little heads will start bobbing, you might see their little nostrils flaring, and the skin in between their ribs, you can sometimes see that pulling in and here as they're trying to get that breath in. That's an indicator that your baby's working really hard to breathe. You may have seen them do this, especially if you've had a journey through neonatal intensive care and special care. You might have seen them do this previously. So it's about recognising if anything's different and calling for help. If your baby was to ever have a colour change, so if they were to go dusky or blue, you'd want to quickly check all of your connections, and we'll go through that in a minute. Turn them up onto double their normal oxygen. So say if they're on 250 mils, you turn them up to 500 mils. And if they don't go back to their normal colour, you want to call an ambulance straight away. A lot of the things about identifying if your baby's looking really unwell and working hard isn't just because it's on oxygen. This is what you would do with any baby that you had at home. If you walked in and they were really struggling and you were really concerned, you'd call an ambulance. Same thing if they're on the oxygen. I guess one of the things is you've actually got oxygen at home, so you can turn them up and give them that bit of oxygen while you're waiting for help to arrive. Something that absolutely has to be reviewed is a temperature. Any temperature in a baby needs to be urgently looked at. So if your baby was to have a temperature, you need to get them reviewed by your GP. If you can't get in there, take them to hospital. And again, you can always bring them in here to see us. I'm here most days and there's always a doctor here. So you can ring our reception and make an appointment. Now looking on to the safety checks. So this is something that I say to do with every nappy change. And the reason for that is it's something that you're doing all the time, or at least every sort of 2 to 3 hours. So it just means that if there's any problems, they're being picked up in a timely manner. So first of all, start at your baby. Because they're having a nappy change, they're going to be sort of semi-naked. So you can have a good look at their breathing and chest, make sure that that's all looking normal to you. Then you want to just have a look at their oxygen. So gently pull the prongs out of their nose and make sure that you can see the end of the oxygen prongs and make sure they're not blocked with any secretions. If they're starting to block, you'll often hear a bit of a high-pitched whistle. And if they are blocked, you will need to probably change your prongs, and we'll go through that. Just make sure that they're not pressed up too hard on the bridge of your baby's nose, because it might just cause them to get a little red, uncomfortable area there. Then work your way along the tubing. Make sure there's no kinks. Make sure things like the tubing and any toggles aren't causing any uncomfortable spots on your baby. Then you want to just work along the tubing, because again, you're going to have all of that extension, so just make sure everything's connected. Make sure that it's connected to the oxygen and that the oxygen's turned on to the proper amount that it should be on. One of the biggest reasons I get phone calls is that someone's thought someone else turned the oxygen on when they changed tanks or anything like that. So it just means that you're picking any problems up really quickly. Very briefly disconnect your oxygen. Make sure you can hear and feel the flow of oxygen, and then quickly reconnect your baby. If they're on a really small amount, say 125 mils, it can sometimes be hard to hear the oxygen. So if you can't feel it, just briefly turn the oxygen up so you can hear and feel it, and then turn it back down to your baby's amount and reconnect them. This needs to be done, like I said, very regularly, but also check your regulator is working okay by checking for oxygen when you change your regulator over or you're going from tank to tank. If you can't hear or feel any oxygen, it may indicate a problem with your regulator. So quickly change them onto another tank and regulator and ring your oxygen company or MAS and let them know that this has happened and you need a new regulator. The other thing to keep an eye on is your baby's weight gain. So weight gain can be a really good indicator of how well the oxygen's working. Generally, we aim for about 120 grams to 150 grams a week. However, again, it's what's normal for your baby. So if your baby's normally gaining, 200-300 grams and they suddenly start gaining less, that's something we want to know. Basically, for the first few weeks at least, it's a good idea to weigh your baby weekly, just so that we can keep an eye on how their weight gain's going. It's also a good idea to try and use the same scales. So if you haven't got scales that are easy to get to, say at your local chemist, you're more than welcome to come in here and use our scales. And then if there's any problems, we may need to review to see why they're not gaining weight. Same thing with feeding. Feeding is a good indicator of how your baby's going. So if there's any changes to your baby's feeding, again, we want to know. Sometimes if they're becoming a little unwell, babies might change their feeding habits. So once again, it's about recognising any changes and just letting ourselves or your paediatrician know. So let's move on to changing the tapes and the prongs for your baby. This is something that a lot of people find fiddly for the first couple of times, and that's completely fine. The biggest thing is it doesn't have to look perfect, it just has to hold the prongs in. So changing your tapes and your prongs happens every 7 days, unless your prongs get blocked or your tapes fall off or your baby pulls them out, which does happen. What you want to do is make sure that you've got everything ready to go. I'm using slightly different prongs today. What you'll get delivered with your oxygen is these prongs. They're clear and you'll get approximately 4 a month. That's how many you're allowed with your MAS supply. They'll also give you some to take home from the hospital. If you're running short on prongs, just when you reorder your oxygen, let them know that you also need new prongs. Because you get 4 a month and you're changing them every week, it's usually more than enough. If for some reason you were finding you were really going through your prongs because you were needing to change them sort of every couple of days because of secretions, you may need to wash them out. It's step by steps through the information in your white folder how to do this. But if you have any questions about that, you can certainly let me know. It's just something that you would very rarely have to do, but we will go through washing them out after this. So just make sure that Bub's nice and comfortable and wrapped. With your prongs as well, you'll see that there's a slight curve to them. So when you put them in your baby's nose, you want to put them in like this and follow the gentle curve of their nose. Now, first of all, what we're going to do is wash our hands. So make sure that yourself and your helper wash their hands thoroughly. Now, my little baby has got different prongs on today, and that's because this baby's actually able to be alcohol wiped and taken in and out of hospital, but she actually doesn't have nares at all, so that's why I'm using these prongs. You'll note I've cut these, and that's just, as I said, because she doesn't have nostrils. You would never ever cut your prongs at home because it can cause trauma to your baby's nose. So after you've washed your hands, just make sure you've got everything ready. You'll get a supply of the Comfeel, which is the nice soft tape that goes on your baby's face, and the Fiximol, which is the one that holds the oxygen tubing on. So I always get my helper to stand behind. Make sure that you've pre-cut out your tapes to your baby's face size. One thing that is a good thing to do is when you get home, just pre-cut out a few templates, because you'll find if your baby pulls their prongs out in the middle of the night, you don't want to be trying to find tape and cut it up. So just make sure you've always got everything ready to go. I'm also going to demonstrate how to use tender grips. It's just another way of taping that a lot of our families really like. Now you'll find by 7 days, the tapes are pretty much ready to come off. There's all sorts of adhesive removers and things that you can buy to tape the tapes off, but they're quite smelly and quite oily, so you really have to make sure that you've wiped the remnants of them off before you put your new tapes on. I find that just a wet soapy face washer is just as effective. So I find I get my helper to stand behind and hold my baby's head. Wrap your baby so you don't have their little hands helping you. And then I just start from the corner, put my flannel underneath, and I gently massage it all off until it's all lifting off. Like I said, the first couple of times can be a little bit daunting. So that's how that one comes off. Now this smaller one comes off a lot more easily because it's a lot smaller. So you wouldn't necessarily have the two different taping options on their face. I'm just showing you both of them as your options. So this one just lifts off as well. And then my helper's going to hold the oxygen in still so that my baby's still connected to oxygen while I'm getting everything else ready. So I'll make sure my tapes are all ready to go. And that my new cannula is ready to go. Make sure that the nasal prongs are facing the right way with the curve that I showed you before. And then I'm going to get my helper to remove the old tubing, get rid of all of that. I'm going to put the new tubing in, and then my helper's going to hold my baby's head and hold the tubing in while I quickly disconnect the old prongs over here at my oxygen and plug in the new prongs. Then because my helper's holding it on, I can just take my time putting everything back on. So I'll start with this one. Try and get it as close to your baby's nose as possible, because their little fingers will get in there. And my helper just holds that oxygen on, and I get the next shape out and pop that on. Now, this does not have to look perfect. You'll find you'll just have it all lined up perfectly, and then your baby will move. So that's that first way to tape. The second way is to use these tender grips. These are an all-in-one system. So I just loosen up that top layer. Now, because they're a little bit bigger, I tend to put them a little bit further away. So just here, but still on your baby's cheek. And then I pull up the clear bit, pop the tubing in, and then the clear bit goes back over. And that's all done. Again, make sure, big cuddles for baby because they're probably going to be crying at this point, but make sure everything's connected and your oxygen's turned on to the amount that it's supposed to be. So those are just a couple of options on how you tape your oxygen in. If you find something that works better for you, that's completely fine. Some of our families have found other ways of taping that works for them. As long as the tapes are secure, that's completely fine. As long as everything's making sure that the nasal prongs stay in, however it works for you is fine. It's incredibly rare to have a reaction to this tape, the Comfeel and the Fiximol, and it's probably how your baby's had their oxygen taped while they've been in hospital. Very, very rare, but obviously just still make sure that you're keeping an eye on their skin to make sure they're not having a reaction. When you lift the oxygen taping off, when you're changing the prongs, it's not uncommon to have a little red area underneath, and that's fine. It will heal. You just want to make sure, if you can, maybe move the tapes around a little bit just to give their skin a break. If you have any worries at all with that though, just please don't hesitate to call me. As I said, there's lots of different tapes on the market. There's lots of Facebook groups as well that you can jump on and have a look and see what other people all over the world are using to tape their oxygen. These are just two ways that lots of our families use. So that's what I've demonstrated today. So as I said, every 7 days you change the prongs and the tapes all at once. Throw your old prongs out and you're all done. If, like I said, you're finding that you're needing to reuse oxygen prongs, and incredibly rare, usually our families find they've got more than enough prongs. But if for some reason you are needing to reuse them, as I mentioned before, it steps you through how to wash them in the handout that you've got. But basically, wash them in warm detergent water, rinse them out, and then you need to make sure that they're thoroughly dried out. So how I do that is I actually connect it to my big tank and turn the oxygen up really high to blast the water through and dry the inside of the tubing, and then I just hang them to make sure that all the water's come off the outside. You want to make sure that they're thoroughly dry before you use them again. And then once you've washed them and dried them, you can just pop them in a little Gladware bag or something like that to keep them clean and the dust off them until you need to use them. Like I said, I don't spend a lot of time on that because it's very rare that you'd need to wash your prongs out. Most people find they've got more than enough. So when it comes to weaning your baby off oxygen, all babies wean in very different ways and at very different times. Your doctor would have talked to you about an approximate amount of time that they might be on oxygen. This is very much an approximate time. When it comes to weaning, we'll bring your baby back in for a review. This is done every sort of 4 to 6 weeks after your discharge, and then every 4 to 6 weeks thereon. What will happen is you'll come into the Mater Children's Private, which is in the Salmon building up on level 7. You'll either be admitted to the ward and have an overnight oximetry. I'll set that up for you. You stay overnight, and then the next morning, myself or one of the doctors will come and pick it up. We'll download all of the information and make a decision there as to what might happen with your baby's oxygen. While they're a patient up on the ward, we'll ask the nurses to do different things with oxygen, so maybe turn it down for a little while, maybe turn it off for a little while, so we can have a look what's happening throughout the night while your baby's being monitored. Where babies use a lot of oxygen is at different parts of sleep, after they've had a feed and they're trying to metabolize all of that energy, all of those sorts of things. So we like to get a good 8 hours of data so that we can make a good clinical decision. Another option can be you might actually go down to the sleep unit and have a bit of a more thorough sleep study. Your doctor will make the decision as to what's the best thing for your baby, and our reception staff will ring you and make an appointment for you to have those two things done. We'll book your bed. You don't need to worry about any of it. The hospital will be in touch to let you know what time to come in, things like that. One parent can stay. Unfortunately, it is only one parent. Two parents can't stay. It won't be the most comfortable night's sleep you've ever had, but we try to make it as painless as possible for you. So basically you come in at around about 3 o'clock in the afternoon, we set up the monitor for your baby, and then generally any time after sort of 6 a.m, 7 a.m, if your doctor's happy, you can head home. One of us will collect the monitor, download it and ring you to let you know what the plan is. Your doctor may want you to stay in longer so that they can have a chat to you. They'll let you know what the plan is. Like I said, they will all wean very differently, so they might wean down on the amount of oxygen that they're on. So say they might go from 500 mils or half a litre down to 250 mils or a quarter of a litre. Sometimes as well, they might wean to only needing it when they're asleep. We'll go through all of this with you, and we'll tell you as well what to look out for after your baby's weaned. Okay. So as I mentioned before, you would have either received this white folder with hard copies of all of this information, or you might have received all of this information in email format. Either way, rest assured, everything's there for you to have a look through. Once again, I'll just draw your attention to the going home checklist. So this goes through what we've been through today, and these are the things I need you to feel happy about before you go home. Also, while you're in special care or in the ward, they'll go through CPR training with you and also some SIDS education. So please ensure this is done as well before you go home. As I said, here is the handout on everything that we've been through today, and it goes for a few pages. This pretty much covers off everything I've just covered, and you might have received it, like I said, in this folder or an electronic form via an email. It also has in the tender grip, which is those little circle tapes, step-by-step how to change them as well, and also step-by-step how to change the Comfeel and the Fixie-Mole. On the back page of this handout, or on the last page of it in your email, it lists all of the important phone numbers that you need to know. So the numbers are our number if you need to speak to myself or one of the doctors, the after hours doctor number. So your doctor might have given you their private mobile number, but one of the doctors will always have the after hours mobile, so you can ring that anytime you need to. This is the number for MAS to reorder your oxygen. So if you're finding that you're needing to get new tanks, this is the number you call. This website here, Independence Australia, that's the one I find is the best place to order your tapes. So your Fixie-Mole and your Comfeel for taping on your baby's oxygen. You'll get a supply from special care or from the hospital when you go home as well, but once you need to reorder, that's the email address you use. If you do decide to use the tender grips, you order them through us. So we order a whole stack of them just so you don't have to set up an account with the company and leave them here. Just so it's easier for you, you just ring up, pay for them over the phone, and our reception staff will post them out to you. Just a note on keeping your baby well. All babies babies are more susceptible to becoming unwell because they haven't built up an immunity yet. So it's vitally important that anyone that's coming into regular contact with your baby has had their immunisations and that they're up to date. Anyone that hasn't had a whooping cough booster in the last 10 years should have a whooping cough booster. These are people that are coming into regular contact with your baby. It's also really important that they have the annual flu vax and that you do as well. It's very important that you make it clear that anyone that is at all unwell with a sniffle, sore throat, cough, anything like that, stays away from you and your baby, particularly at this time. And the most important thing is lots of hand washing. Make sure that you've got that alcohol gel around, that you can easily use it. When you've got older siblings and other kids at home that go to school or daycare, it can be really hard to keep them away from your baby, and that's generally where germs come in. That's fine, you can't keep siblings away from your baby. Just make sure that you're encouraging them to wash their hands frequently. And of course, if you think your baby is brewing a little cold, please don't hesitate to let us know or get them reviewed. Through winter, there is a vaccination for what we call RSV. RSV is the virus that causes a condition called bronchiolitis, and that's what sees quite a lot of babies hospitalised throughout the year. Depending on what stage of the year we start the RSV vaccination, myself or the respiratory department at Queensland Children's will be in touch with you to let you know the plan with that. Babies that are born prematurely and are on oxygen are eligible for the RSV vaccination. Other babies aren't. So if you can get it, it's always a great thing to be able to get. And as with anything, make sure that your baby is fully up to date with their vaccinations when they're old enough to get them. So the take-home messages are, you should now have a bit of an understanding of how to check on your baby when you're at home, how to check that everything's working well with your oxygen and your regulators, how to dial up your oxygen, what to do if you're worried. So I really want you to understand what to do if you're concerned and who to call. So you can always call us, like I said, your GP, your paediatrician, the after hours number if you want to speak to one of our respiratory doctors. If you are concerned though, please have a very low threshold to getting them urgently reviewed. So make sure that you call an ambulance or take them to hospital if you're really concerned. If it's just something that you want to ask, but it's not that urgent, you can always ring me, or you can flick me an email if it's the weekend, because I check my emails all weekend. But like I said, if you're ever really concerned, please don't hesitate to call an ambulance or get them urgently reviewed. Also, just make sure that if you're needing to reorder your oxygen, or if you've got any problems with your oxygen, call MAS or your oxygen supplier, and they would have left you their emergency number, your oxygen supplier, when they dropped off your oxygen. After you've watched this, I'll give you a call, or please don't hesitate to call me at any time just to go through any questions that you might have. So thank you so much for watching. Like I said, if you have any questions at all, please don't hesitate to ring me, but I'll be in touch with you as well, just to make sure that you're feeling really happy and ready to take your baby home. You know where we are if you need us, and please, like I said, don't hesitate to call. Thank you.